around all sexual health, really, sexual health across the age spectrum. But I guess I do a lot of focus on young people's sexual health, so I coordinate the 3-in-1 scheme, and we also do lots of commissioning in our team. So we commission the main sexual health service, and we commission third sector organisations to do work around HIV prevention. But I don't actually do any work alongside young people anymore. I used to in other roles, but not anymore. So I've got my colleague Catherine here co-training with me today.
Yeah, so I'm from the Health and Wellbeing Service, and so my role involves direct one-to-one support with young people, and then also going into schools and delivering the sex ed provision in secondary schools and puberty education and that type of thing in primaries. So yeah, that's me.
So normally we do an introduction and give everyone a chance to say where you're from, where you work, and who you are. But we've got quite a lot of people on today. So what I'm going to tell you is we've got a few people from the public health nursing team. We've got quite a few people from the youth service and Youth Point. We've got someone from Barker, and we've also got someone from midwifery. Have we got anyone new here today that I've not covered that wasn't here on last week that would like to introduce themselves? No pressure if you don't want to.
Hi, I'm Lauren. I'm from Leeds City College.
Hi, Lauren. Welcome today. Is there anyone else? So today's session is it's not so much an interactive session as the one we did last week. Today's session is a lot more of me sort of talking and going through what services there are, but there are opportunities for you to ask questions and interact as well. So please do. You can either do that via the chat function, or you can call, shout out loud. We'd welcome either way. But yeah, today's session, it should finish around 12, but we might get finished a little bit earlier. And we are recording today, just to let you know. I know that I let a lot of you know that we were recording already, but we're recording this session so that we can post it online and allow people that have not been able to come today to watch it later. So yeah, the first thing I want to ask you about is, where do you think young people can get sexual health support and advice from in Leeds? Any ideas? What places are there in the city where young people can go?
Feel free to talk out loud or put your answers in the chat.
The sexual health clinic in the city centre.
Yep.
Anywhere else?
Leeds Public Health at Tech North.
Yeah, so we've got the Public Health Resource Centre. Any other ideas? Is anything coming up in chat? I can't see the chat.
Yeah, I was just about to read it out.
Sorry.
So, yeah, we've got the youth service coming up in the chat. People are saying the youth service. And schools.
Definitely.
Doctors, surgeries.
Mm-hmm.
And from the parents.
Yep. So I think traditionally we concentrate on like the specific sexual health clinic, and sometimes there's a temptation to send young people that need sexual health support or advice directly to the sexual health clinics, but actually there's lots of different places where they might feel more comfortable, or where they might get more appropriate advice for them depending on what's wrong or what they want to talk about. So yeah, that's brilliant. There's lots of different avenues that young people can go to, and parents is a really good one as well, because I don't not all young people feel comfortable talking to the parents, but lots of them do. So yep, we're going to go through today all the different services that we have in the city, well, most of them anyway, and then give you some ideas about where you can find out other places for support. So like you mentioned, we've got Leeds Sexual Health in the city. Leeds Sexual Health sort of came into being in 2015. It was the time when all our sexual health services became integrated. So we didn't have a separate GUM clinic and a separate contraception clinic. We sort of put everything together in one big integrated service. So it offers both contraception and testing and treatment for all STIs in one place. So we've got a central hub clinic in the Merrion Centre. Also, if you need to find it, it's pretty easy to find as well. But not only have we got the city centre site, we've also got 4 community-based clinics as well. So they're in Armley, Bermontoft, Beeston and Chapeltown. And they're all open on different days of the week. All of them have got sort of a late night opening time. And the city centre one's open on an evening as well. Now I'm talking here as if we're not in lockdown and we're not in COVID. So I'm going to talk to you about what happens in normal times and then give you some information about what's happening now, now that services are disrupted. So this is what happens usually. And Leeds Sexual Health has got a really great website as well, leedssexualhealth.com. It's emblazoned on all of our presentations and all of our promotional stuff, really. It's where you can get information on the service and on the clinics, but also on all the sexual health services available to young people, well, to anyone really in Leeds. So it's not just about the clinical services. And you can do self-triage on the website. You can book an appointment online or by phone, and there's a live chat option as well. So just a reminder that that's in normal times. Has anyone got any questions about the sexual health service?
No, there's nothing coming up in chat.
Thank you. So normally, because the sexual health service is for anyone of any age, they usually put on a specific clinic time for under 18s because they're aware that young people might not necessarily want to come in at a time when they could see someone they know, when older people are using the clinic. And they've tried to think of a time that might be a little bit more convenient for young people to come in. So they have a specific under 18s clinic on an evening between 3 and half 5 on Mondays to Thursdays. So only under 18s are allowed in at that time. You're not allowed to go with a parent or a staff member, and no other people should be in the clinic that are older than 18. It's a drop-in service, so you don't need an appointment, and you can talk to the youth worker there. All the staff that work there are really experienced in talking to young people and really experiencing making them feel comfortable and talking to them about any safeguarding issues as well if they should come up. And young people can get contraceptive advice, they can talk about STIs, they can get tested, they can pick up free condoms, and they do lots of work around support and advice as well, talking about the relationships. They will really spend time with a young person to make sure they've got what they need. At the moment, that clinic's not happening though, unfortunately, because of COVID. It's not moving on.
What about, Kerry, what about the fast track, the ability to fast track them? What's happening there?
So I'll talk about that in the next slide in a minute, but you're still able to fast track a young person, and a young person can still attend at the moment. In normal times, if you've got a young person that you feel is vulnerable or you feel that they need to be seen, you can call the health advisors. So the number is on the website. You can call the health advisor and let them know you've got a young person that's coming. And there's also a form that you can print off the website as well. So you can give that young person a form already filled in to take with them to hand into reception. If you know a young person, for example, is going to be too shy to talk about what's wrong or might not be able to explain that well, you can give them the confidence of taking that sheet already filled in with you to give to the receptionist. So yeah, they're really open to talking to staff members with that young person's permission. They're really open to talking to you about how they can best support a young person. So maybe it's a young person that is not confident to sit in the waiting room, so what they'll do is just try and make sure that person is brought in as soon as possible. They can even do outreach work, so they'll see someone in a different place. So they've worked with young women who perhaps have got learning difficulties and met them elsewhere. They've even done fitted contraception outside the clinic. So they're really flexible if necessary. It's always worth talking to a member of the staff about what they can do to support a young person. So we've got a video to show you, and I'm hoping that it's gonna work. If not, what we'll do is we'll put the link to the video in the chat, and you can sort of open it up yourself, hopefully. This video we made sort of late 2019, and it got finished early last year. It was made with, so the young woman you can see on the screen there, she's a Leeds University student, so she had quite a lot to do with what we said and how we made the video. And we also talked to lots of young people about what they were frightened of or worried about in terms of visiting the clinic. So we tried to use this video to answer their questions about confidentiality issues, fears that they might have about what do you get asked and who's going to be there and what happens. So this is kind of a walkthrough of what happens when you visit the clinic when COVID's not around, just to sort of give you an idea of what it looks like and to allay any fears. So I'll try and press play.
Leeds sexual health clinics are open to everybody in Leeds, no matter how old you are or your sexual orientation. The staff are respectful and caring. They won't judge you and all services are confidential. You can choose to go to a walk-in clinic and wait to be seen or book an appointment slot online or by calling. There are young people only sessions just for under 18s on most afternoons. When you arrive, wait behind the line to allow the person in front of you some privacy. The receptionist will ask how they can help. If you booked an appointment, you'll be given a slip to check that they have the right details for you. If you're here for a walk-in, you'll be given a board to fill in. The nurse in charge uses the information you've given to look at who is most urgent and to book people in to see the right person. The clinic staff do their best to see as quickly as possible, but sometimes there is a wait to be seen. Rather than asking you to explain out loud, where possible, the staff will point to written information on your board. When it's your turn, you'll be called by first name only. If this is a problem, let the reception staff know what you'd prefer. All the consultation rooms are private and conversations cannot be overheard by other people. You'll be asked information about yourself, such as your name, date of birth and address. The worker will ask about the sex you've had, as well as other questions about your life, your friends and relationships. They ask these questions to check you are safe and have support, and will help the worker to give the best advice and treatment for you. Don't worry, this information will not be shared with anyone outside of the service, including your GP, without your permission, unless they are seriously concerned about the safety of you or somebody else. Your parents or carers won't be told you've been to the clinic, and their permission isn't needed. Anyone over 13 can give their own permission for tests, treatment, contraception or abortion. The worker you see will check that you understand the information being given and are happy and confident with your decision. They will encourage you to think about talking to your parents or carers if you can, or perhaps another trusted adult. However, you have the right to confidentiality and privacy even if you are under 16. Many people are nervous when they come to clinic. They might be worried about needles, whether procedures will hurt, or what a test result might mean. The caring staff are very experienced and will do all they can to make sure you feel comfortable, explaining what will happen and checking that you understand everything. It's up to you how the clinic gets in touch with you. These sexual health clinics aren't the only place in the city where you can go for help with sexual health. Your GP or doctor can also help with contraception. Many pharmacies offer free emergency contraception, and there are lots of places where you can pick up free condoms. As well as the Marion Clinic, there are other Leeds sexual health clinics across the city. Check the website for up-to-date clinic addresses, times and how to make an appointment. Go to www.leedsexualhealth.com to find the best place for you.
Has anyone got any comments on that or any questions about the video? No.
No.
All right, Brill.
Oh wait, we've got a couple of message people typing.
All right.
No pressure to make it good now.
Is there anything else?
No, not yet. No. Oh, it was really good and clear. It can be really good to use, some Tracy's put, so thank you.
Oh, thanks, Tracy. And yeah, those videos are published on the Leeds City Council YouTube channel as well, so if that helps in terms of getting it unblocked, and that's where you can go to find it as well. If you lose a link to it, if you have a look at the Leeds City Council channel, you should be able to find it there. So coming back to Leeds sexual health then during COVID-19, the service have been amazing and really mobilised to make sure, although face-to-face services are really limited, as you all know, they've tried to make sure that the service is not limited as much as possible. So although walk-in clinics are all suspended, you can't just turn up as you used to be able to at a time. You can be seen. If you need to be seen, you will be seen, definitely. The first number on here is the number you can call if you've got symptoms of an STI. So if you think you need to be seen, you need testing, you need treatment, you can call that number and you'll speak to a clinician, and they will sort out a time when you can come in to get treatment. And they will give you an appointment time, a specific time to come in. So they are seeing probably almost normal numbers at the moment, to be honest. So yeah, you will be seen. You won't be left to suffer at home. And they also have a live chat option, like I mentioned before. So you can go on the website, and again, a real live person will answer you. You won't be just sent a message, and you can speak to a clinician on the other end of the website and ask them questions if you prefer to do that rather than talk live. So yeah, they're really responsive to young people ringing, and if any young person rings and they feel that they're vulnerable in any way or need seeing, they will prioritise that young person. And workers can support a young person to call as well. So you might have heard that it's more difficult to get contraception at the moment. Earlier on in the last lockdown, people were saying, if you've got LARC, then you need to be waiting and have a bridging method. What they're doing is they're trying to make sure that young people will get LARC if they need it, and women as well of all ages. They'll try not to put any sort of delays on the time it takes to get LARC. So by LARC, I mean long-acting reversible contraception. So there's not really as much of a waiting list anymore to get implants and coils fitted. They will try their best to see you, basically. And if they can't, they will give you another form of contraception in the meantime. So service is been amazing over COVID. It's just making sure that people know how to get hold of them and what the best way to do that is. Again, if you go on leedssexualhealth.com, a pop-up will always pop on the screen whenever you log on to tell you this information, tell you what to do. So you're not going to get lost in the website looking for which services are open. Has anyone got any questions about that?
There's none in the chat.
No. Okay. So this is just to give you a chance to have a look at what the website looks like. It's user friendly, but as I said, the pop-up will come up to direct you about the most up-to-date information, and it's worth checking on it regularly because things do change quickly. They have to respond quite quickly to things happening, so it's worth always checking. But in normal times, there's lots of educational information on there as well, so you can find out about different types of contraception. You can find out about what symptoms there are of certain STIs. There's information about sexual assault and rape, because the service will also support people who've been sexually assaulted and help you to speak to the SARC, so the Sexual Assault Referral Centre. They can sort of work around the whole person, really. It's not just about contraception and STIs, it's about supporting that whole person in terms of the sexual health. The really good function of the website, I think, is the service finder. So again, you might not use this at the moment, but usually if you were wanting to find out what's the nearest service to you that's open, that's appropriate to your needs, you can look on the service finder and it'll tell you, you can choose where you can get a C-card registration, and it'll pop up on the map and it'll tell you what's open. You can click on each marker and it'll tell you the address. It'll tell you what services they have available. It might even tell you which staff members are there. There's a function to have a photo of what your service looks like on the outside so young people can find it easily. So yeah, it's really user friendly in terms of young people knowing what's in their area. However, it does rely on you as a service making sure your service information is up to date. So once you're a fully fledged 3-in-1 site, you need to be making sure that we know your opening times, and if you're closed for any reason, or if you're changing your site details, making sure that we know so we can make sure our website is as accurate as possible. Has anyone got any questions about the website? Nope. Okay, so the pros and cons of Leeds Sexual Health are it's opening on an evening and on a Saturday for the main sexual health clinic in town. It has an under 18s clinic, so hopefully young people will feel confident attending. It's got all sexual health services under one roof, so you might go and talk about contraception, but the staff there might say, maybe you should have an STI screen while you're there. It's all sort of, you don't have to then make a different appointment. And they are the sexual health experts. That's their bread and butter, what they do every day. The cons are, it can be a little bit daunting for a young person to attend the clinic, although they try and make it as as unscary as possible. It can be a bit worrying going to a big clinic like that. And for many young people, a less specialised service will meet their needs. So they might want to talk about sex and relationships and get some condoms. They don't necessarily need to go to a full-blown sexual health service for that. So there are other services that might be better for them that are in their area and maybe with staff that they already know and trust. Some of you mentioned going to your GP, and we don't always necessarily think of using our GP for sexual health services. I think because in Leeds we've got such a well-known sexual health service, but our GPs can offer a really good range of sexual health services, and you don't need to use that specialist clinic really. If you need LARC, for example, most GPs are able to fit LARC, so implants and coils, and they should be able to sort you out with other forms of contraception as well. You can get emergency contraception from your GP. Some of them, not all of them, do STI screening, and you should be able to get a cervical smear from your GP as well. The pros and the cons though about the GP is, the pros are it's close to where the young person lives, so they should know where it is. They should be able to get there easily. It's not obvious that you're seeking sexual health support, so if you are seen in your GP surgery waiting room, people that see you aren't necessarily going to know why you're there. You could be there for any reason. And they tend to be trusted services, so you trust your GP, you trust your GP's advice. The cons are though, sometimes it's difficult to get an appointment with your GP. Sometimes you might feel that you have to talk to the receptionist when you ring to say where you're going. That can be off-putting for young people. If they're wanting to get emergency contraception, for example, they need a speedy appointment, but they might not feel confident saying that's why they need to go. And there's usually a few fears for young people about confidentiality, so they might be worried that the parents will find out they've been. Some young people have reported worrying that, you know, you get a text reminder sometimes that you've got an appointment, that text might go to the parent. So yeah, they're sometimes worried about how confidential their information is. And some young people prefer to go somewhere that's completely anonymous, somewhere that they've never seen that member of staff before. They can go in, get the sexual health advice or contraception sorted and not go back. So it depends on that young person whether they prefer someone they know or somewhere where no one knows them at all. Has anyone got any other experience of young people using their GP? No. I think the message has to be that we don't want young people to forget that GP is an option, really, because if we send everyone as well to Leeds Sexual Health Service, would be overwhelming them when actually you might get a faster, more appropriate service if you use your local GP sometimes. So 3-in-1. Most of you are here because you're training to become part of the 3-in-1 scheme, but for those that are not doing the full course and just here for today, we're just reminding you that 3-in-1 is available usually all the way across the city. We've got lots and lots of community sites. We're one of the last cities really in the country to have a 3-in-1 scheme or a C card scheme, and we're hoping to continue it for a long time to come really. We offer condoms via the C card membership, so free condoms and lube. We offer pregnancy testing and chlamydia and gonorrhea testing kits, and it's available to all young people aged 13 to 24. There are lots of cities in the country where they don't offer free condoms anymore, and they don't offer pregnancy testing and chlamydia gonorrhea testing unless you go to the sexual health service. So we're quite lucky to have this, and we're quite lucky to be able to train up people in really diverse roles to talk to young people about sexual health, because we think it's really important that sexual health is everyone's business, and we know that young people really prefer sometimes to talk to people that they're really confident with, so their youth worker or their support worker. They've already got that relationship, and that worker can talk to that young person about what else is going on in their life. So it's a good sort of grounding for talking about sexual health. At the moment, as I said, lots of 3-in-1 schemes can't operate as usual because they can't do face-to-face work. So what we've set up is a postal service. It's not ideal because not all young people want condoms posted into their home, but for those that do, they can, if they've already got a C card, they can go on Leeds Sexual Health on that link, and they can arrange for condoms to be posted to them for free. So all they have to do is put in their name, age, address, and their C card number or ID code. It's not perfect, so if you've not already got a C card, you can't order condoms, but there are some other options that young people can do. So the youth service and some other organisations like Leeds City College are distributing condoms, but it's difficult in the lockdown that we're having now to arrange that. So you might get condoms via detached work, but we're trying to get a way of offering registration in a more formalised way. So we're talking to Leeds Sexual Health about whether we can do that sort of virtually, and we're looking at different options for doing that. Has anyone got any questions about 3-in-1 scheme? No?
No, not on chat.
All right. So, oh, is that one coming up?
Yeah, it said no.
No. So the pros of 3-in-1 are we've got loads of sites and they're really spread across the city. They're not just targeted in certain wards, they're everywhere. And they're run by staff that are really skilled at working with young people. I think that's probably the main thing, really. Staff that know the young people and know how to talk to them confidently. And they're trusted services, and we make sure, because people come on the same training, the messages are the same. And young people can choose whether they've got a relationship with a member of staff or if they prefer to go somewhere anonymous, just a drop-in. The cons are we can't provide specialist sexual health advice and treatment, but because all staff are trained and know where to signpost young people, they can sort of swiftly make sure that they can get to Leeds Sexual Health or the GP if necessary. So you might not be aware, I hope you are, but you might not be aware that we have an enhanced sexual health pharmacy scheme in Leeds. So we've got 39 pharmacies that are part of the scheme, so we commission them to be part of it. And they've got trained pharmacists, and those pharmacists can provide free emergency hormonal contraception without a prescription. So normally, if you need emergency hormonal contraception, you'd have to go to your GP, you'd get an appointment, you'd speak to them about you had unprotected sex or you had an accident with your contraception, and you'd have to get a prescription, then you'd have to go and get that prescription. This way, if it cuts out that having to get an appointment, you turn up at the pharmacy, you have a short consultation with a pharmacist, and they can provide the drug there and then for you to take. So it's really trying to make sure people don't get a delay in getting emergency contraception, basically. We've tried to make sure that all the pharmacists are in sites where we know there's areas of deprivation, we know there's high levels of teenage conceptions, we know there's high levels of terminations, but when you look at where they are, they basically serve most people in the city. They're really accessible to most people in the city, basically. We've got one in the city centre, and then there is spread really well. If you look on leedsexualhealth.com, it'll tell you where all the pharmacists are. They also offer free chlamydia and gonorrhea testing kits for 16 to 24-year-olds as well. What I would say if you're sending a young person to a pharmacy to get emergency contraception is make sure they call before they go. In normal times before COVID, I would say still call before you go, just to make sure that pharmacist is on call. So if they've gone for the lunch, for example, and there's a locum in that's not trained to offer the scheme, they might get turned away. So it's always worth ringing first. At the moment, because of COVID, it's still worth ringing because they might be able to do some of the consultation over the phone first, and then it's less time for that young person to spend in the pharmacy in that sort of confined consultation room. The good thing about the pharmacies is the ones that were chosen to be part of the scheme not only had a trained pharmacist, but we had to make sure that they were really accessible in terms of opening time. So often they're open on Saturdays and Sundays, they're open till late, so quite a lot of them are open till like midnight or 11 o'clock at night. We just want to make it as easy as possible for people to get a hold of emergency contraception. Has anyone got any questions about those? Oh, I'll come to that in a second. The pros are, like I said, there's lots of sites spread across the city, and they're open evenings and weekends, and you don't need to get an appointment. It avoids that potential embarrassment of telling a receptionist why you need a quick appointment. And pharmacies are trusted services as well. The cons are they don't have the time to do in-depth relationship support and advice. So if they do get a young person that they're concerned about, they are trained to do like a safeguarding referral, but they haven't got time to be talking to that young person about safety and relationships and, you know, doing that kind of wrap-around youth work kind of care. But they are a quick way to get hold of that drug. So, a bit of a quiz for you, just to check. How soon after sex must emergency contraception be taken for it to be effective? How long do you reckon? Do you think 24 hours, 3 days, 5 days, or a month? Little pop quiz. Shout out if you want, or put it in the chat.
There's a few people typing.
Oh, lovely.
So we've got one saying 24 hours.
Yep.
Two saying 24 hours. 3 days. 3 days, but the sooner the better, and up to 5 days, but the sooner the better. We've got 5 days. A range of answers.
Oh, good range. Nobody said a month.
Nobody's saying a month, no.
So it's a bit tricky because we call it the morning after pill usually. It's like that's sort of like the slang name for it. It's actually 5 days. You've got 5 days for it to be effective, but you'd be forgiven if you said 24 hours because we call it morning after pill, and you'd be forgiven for thinking 3 days because that used to be the message. So there's two kinds of emergency hormonal contraception. There's 11L and there's Ella1. So 11L is the one that's been around for a long, long time. And we used to say you had to take that within 3 days or 72 hours, but it's best to take it as soon as possible because it loses effectiveness over time. However, the newer version of the emergency hormonal contraception is called Ella1. So the newer one is called Ella1, and you've got up to 5 days or 120 hours to take that, and it doesn't actually lose its effectiveness over time. But I think what I would still be saying to young people is get it sorted quickly, just so that you don't lose track of time. But so that is kind of the emergency contraception of choice. But it's not up to you to kind of help that young person decide which one. When they go and see a pharmacist or a GP, they'll sort of do questions in the consultation about any of the health issues they've got and the BMI and all that kind of thing to decide which one's the best option. But they have got up to 5 days. Another option for emergency contraception that you might not be aware of is having an IUD fitted. So a copper coil can be fitted, and it can be left in as your continuous method of contraception, or you can have it removed after a month. But that's sort of the gold standard of emergency contraception. Not everyone's aware of that, but it is available even if you're a young person, even if you've not had a baby before. You can have a coil fitted, and that will, you're very, very unlikely to get pregnant. Like almost, well, the percentages are minuscule for those people who get pregnant having one of those fitted. Obviously, you can't have that done in a pharmacist's back office. But when you get emergency hormonal contraception, the pharmacist or doctor will talk to you about potentially having an IUD fitted as well, and then they can sort of facilitate that referral to Leeds Sexual Health to have it fitted if necessary. So these are the places that you can get emergency contraception from. So GP surgeries, Leeds Sexual Health clinics, those pharmacies we've just talked about. But you can also go to any pharmacy, any across the land, and buy it over the counter. The issue with buying it over the counter is it costs quite a lot of money. So I think the last time I checked, it was about £25 for Ella1, but it might even be more than that now. So yeah, you're better off getting it for free or getting a prescription. So another little quiz to check you're all there. Where can a young person get a chlamydia or a gonorrhea test? Have you got any ideas? We've talked about some other places already.
So we've got the youth service, a 3-in-1 site. This is all coming up in chat. By post.
Yeah.
From the doctors.
Mm-hmm.
It's just a couple more people typing, I think. Oh yeah, so doctors are 3-in-1 site or postal, so yeah.
Yeah.
That's it.
So yeah, you covered them all, I guess, really. The main thing to remember is if you've got symptoms of an STI, so symptoms could be painful urine, having an unusual discharge, maybe lower stomach pains, soreness, things like that, unusual symptoms, then you're better off going to Leeds Sexual Health if you can. Go to Leeds Sexual Health Clinic. So at the moment you would ring the appointment line, like I said, and speak to a clinician about going to get tested properly there, because you could do one of these testing kits that I'm going to talk to you about, but they're designed for people that don't have any symptoms. And if you go to Leeds Sexual Health, they can check and they can test for a range of different STIs to make sure you get the right treatment. So yeah, that's something to remember if you've got symptoms. However, if you've got no symptoms, so we know that we talked about it in the last session, we know that chlamydia and gonorrhea, for example, you can have them and have no symptoms at all. So particularly chlamydia is known as the silent STI. So we advise young people, or everyone, that if you've had unprotected sex and you're concerned that you might potentially have an STI but not know about it, it's worth getting tested maybe once a year, maybe more regularly if you've had changed partners. So there are different places where you can get a kit to be screened for chlamydia and gonorrhea in Leeds. So the first thing you can do is go to a 3-in-1 site. So you guys, most of you on this training will be able to offer our kits. So the kits that we'll talk about in the next session, and it gives you everything you need to do the screening on your own, really. It's got everything you need to do. You don't need a clinician there, and you post it off and then you get your results back. You can get those same kits by post. So someone so the Preventex, the company that provide them, will post them to your house. So you can go on the website freetest.me and order a kit to come to your house. However, if you're under 16, if you put your date of birth in, it won't let you have a kit. It'll only allow you to have a kit if you're aged between 16 and 24. So if you're under 16 and you want to get tested, you need to go to a 3-in-1 site, because we're able to give those kits out as long as we've checked that young person's Fraser competent. And again, we'll cover that on the training. Like I said before, the enhanced sexual health pharmacies have got the same kits to give out to people, but again, they're only for 16 to 24-year-olds. There is a way that you can text for a test, but don't think many people do this anymore because it's easy to do it on the website. But if you send a text message to that number 60777, it will send back automated text, and it'll ask you for your details like your date of birth, your address, and again, it'll post you a kit to your house. But again, it's only if you're 16 to 24. But like I said, you can go to Leeds Sexual Health as well. So if you're at Leeds Sexual Health for another reason, they will probably urge you to get tested for everything while you're there. So they can offer to an under 16 as well. So I'm not going to go into great detail about termination services, but just some information about where young people can get an abortion in Leeds. So we have 2 different providers that are commissioned to provide abortion in Leeds. We've got BPAS, which stands for British Pregnancy Advisory Service, and Mary Stopes. Both of these services, you can either be referred to it by a health professional, or you can self-refer. So you don't have to have a doctor or a worker refer you. You can contact them both yourself. So you can go on both of their websites and either ring them or send them a message, and they will sort of facilitate how to be seen. At the moment, a lot of their consultation is done by phone, and they're there to offer unbiased pregnancy choice advice and support. So by ringing them, it doesn't mean you're automatically going down the road of having a termination. They're there to also offer choice advice. So they will talk through with a young woman about what she wants to do, what's best for her. There's no they're not going to sort of push her one way or another, and they're not paid by the number of terminations they provide. They're paid by the advice they provide and making sure that young person or that woman is choosing the right thing for them. Has anyone got any questions about that?
No.
So again, I won't cover this in a massive amount of detail, and there's more detail on Leeds Sexual Health. But in terms of HIV prevention, there are 2 things we can offer in Leeds. So PEP it stands for post-exposure prophylaxis. So this is a treatment that you can take, it's kind of, you can kind of compare it to emergency contraception. It's something you can take that prevents HIV infection after possible exposure. So it's a drug you take within 72 hours of a possible infection. You can only get it from Leeds Sexual Health or A&E. So if you feel there's a really high chance that you've had unprotected sex with someone who's got HIV, then they can offer you this drug to take. You must take it as soon as possible, and it can stop that infection from taking hold. It's not something you give to anyone that's had unprotected sex. You've got to sort of have a good reason why you think you could potentially have caught HIV. Just because it's not a drug that you just can take quite often. It can have some side effects, but it is an effective way of stopping you getting HIV if taken quickly. Another thing that you can take to prevent HIV is called PrEP. So that stands for pre-exposure prophylaxis. So these are drugs that are taken before sex, so people can take them all the time if they're at risk of getting HIV, or they might take them in advance of an event. So if they're maybe going on a holiday, who goes on holiday anymore? But if you're about to go on a holiday and you think you might have risky behaviour while you're there, then you can take this drug and it can prevent you from catching HIV. Again, it's something you would need to talk to a health professional about to make sure it's the right drug for you, but it's available from Leeds Sexual Health, and they can talk to people who feel that they're at risk about how to organise getting that drug. Has anyone got any questions about that? No?
Everybody's in a Monday morning quietness.
So, to check that you were listening, we've got a few scenarios to go through with you. And it's not just to check on you really, it's just to sort of get you to solidify that thinking and think about in a scenario, a real life scenario, what would you do? Where would you send someone? So we're going to go through these scenarios, and I want you to either shout out or again put it in the chat. Where would you suggest that you could send these young people for support and advice? So the first one is a 16-year-old young woman from Beeston who wants to know where she can get a pregnancy test locally. What could you advise her to do? Or what would you do to find out where she could go?
So we've got Beeston Sexual Health Clinic.
Yep, so well remembered, we've got a specific clinic there.
Yeah, a couple of people putting that. Or another local clinic. Yeah, definitely, because it might be that Beeston's not open for a little bit longer, and you might want to go to a different local clinic, even though it's out of their own area. Yeah, you might want to check the website, or I'm just reading some of the things that are coming in off the chat here, or a 3-in-1 site.
Yeah, definitely.
With the local youth service, or the GP surgery and chemist has just come in as well.
The GP surgeries, not all of them do offer pregnancy tests. Some of them do, but it's not an automatic service. So recently we were asked to not put on the website, go to your GP, because they don't necessarily offer that as a routine thing. So she might be better going to somewhere like 3. Any other ones?
I think that everything's been said, yeah. So yeah.
So yeah, definitely go on leedsexualhealth.com to look at what's open and what's near to her. So if not the clinic, definitely she can go to a 3-in-1 site and get one. And with going to 3-in-1, she can get that support and guidance from a worker as well, who can talk to her about her options and start because she could obviously she can go and get a test from a shop cheaply, but she'll lose out on that support.
Yeah, Laura's just put B&M 99p.
Exactly. But yeah, got anyone told you and while you do it and taught you? Is there anything else?
No, that's it.
Fab. Okay, so you got a 17-year-old female who lives in Armley. Her condom is split and she needs emergency contraception.
A pharmacy in Armley we've got in the chat.
Yeah.
Armley Sexual Health Clinic.
Definitely.
A few more people typing. chemist.
Yeah.
Yeah, and chemist again.
Yeah, so I would again say look on Leeds Sexual Health. Oh, got lots of answers coming through.
Yeah, a few more, like 3 in 1. Saying 3 in 1.
So so I'll go back to what I was saying. So she could go to look on Leeds Sexual Health and look at where her nearest enhanced sexual health pharmacy is, or like you said, the Leeds Sexual Health Clinic that's at Armley. If she went to a 3-in-1 site, she could get advice from one of the members of staff there, but they can't offer her they can't actually give her the emergency contraception. So really, she'd be better off going straight to one of our pharmacy sites or a clinic, because otherwise it'd be sort of an additional bit of time. And she could go to a GP as well. Is there anything else you might advise her to do apart from getting emergency contraception sorted?
So we've got maybe take a test. So you might want them to return later on to maybe get a test.
Yeah.
Or if we're talking about chlamydia test and other things, yeah, definitely.
Yeah. So it might be if she's at risk of pregnancy, she could have got an STI as well. So yeah, come back later to maybe do an STI test with you. Take a chlamydia and gonorrhea test if you're 3-in-1 site, or send her to somewhere where she can get that.
Yeah.
What I would say.
Oh,
Go on.
I was going to say it's a good opportunity to promote other contraception like LARC as well. So
Yeah,
you
good
might
point.
want to signpost that way.
Point. Just to point out as well, with chlamydia and gonorrhea tests and quite a few other STI tests as well, quite often the positivity doesn't show up straight away, so you might have to wait a few weeks before you did that, for it to be not a false negative. So maybe 3 weeks before you did a chlamydia or gonorrhea test. But yeah, definitely what Catherine said, good opportunity to talk about maybe a more reliable form of contraception as well as condoms. So any other points, Catherine?
Everybody's put pretty much the same thing, but there is somebody still typing. Oh no, it's gone.
All right. Okay. So, 14 years old, you don't know if it's a male or female. They're sexually active. They would like a chlamydia screen for peace of mind.
Where would they go? What service? So yeah, we've got 3-in-1 or sexual health clinic coming in.
Fab.
Yeah, that's coming in repeatedly.
Brilliant. Yeah, because that's a little bit of a trick question. Because they're 14, they can't order one online and they can't text for a test and they can't go to a pharmacy because all those places, like we said, are for 16 plus. So if you're 14, you have to go to one of those 2 places and get given a test by a worker. But yeah, brilliant. We've got a 16-year-old male who lives in Rothwell, and he's got possible STI symptoms. He's got discharge from his penis. Where could you advise him to go and what to do?
We've got a few sexual health clinics coming in.
Yeah. Because of those symptoms, definitely. He needs to get a full screen, possibly.
Doctors.
Yeah, it could go to a doctor instead. Yeah. Any others?
Yeah. No, that's it.
Yeah, definitely. Fab. So we've got a 15-year-old who would like to discuss getting an implant or other contraception fitted. Where can you send that young woman?
So we've got the sexual health clinic and a GP coming through.
Yeah, definitely.
Yep, sexual health clinic again. Leeds Sexual Health website for a live chat.
Yeah. Yeah, so maybe she could talk to someone about what's most appropriate for her with that person.
And GP.
Yeah. So ideally she'd go to a GP, but for some young people it might be that GP is not the best option, so Leeds Sexual Health the other way. I didn't mention in terms of GP as well, they've got a between practice referral system as well. So in theory, and I don't know how well that might happen at the moment, but in theory, if your GP doesn't provide LARC, so if you've not got a GP that's trained to fit an implant or IUD, they should be able to you an appointment at a neighbouring GP surgery, so facilitate that so you can go there. So just because no one at your branch is not trained, it doesn't mean that you shouldn't be able to get LARC sorted. So yeah, it's still worth contacting your GP for that. The next one, we've got a 16-year-old young woman is pregnant and thinking about abortion. She needs support with pregnancy choices. Can you think what you might do or where you might send her for that support?
So we've got the sexual health clinic coming in.
Yeah, I didn't mention that at the time, but they would be great at offering support.
Yeah, and we've also got on here talking to her midwife. So if she already has a midwife, that's something that they could do if she was then doing that. And then we've got Mary Stopes.
Yeah.
Yep, the 2 clinics. So BPAS as well.
Lovely. I didn't mention that when I talked about termination, but that's a good point. I don't know if you wrote that, Tracy, but we have got a teenage pregnancy midwifery service in the city. And even if that young person has been referred to midwifery and is working with them, it doesn't mean that's too late to change your mind. Midwifery can also support with pregnancy choices as well. And if she then decides to end that pregnancy, that those members of staff can support that as well. I don't want to put you on the spot, Tracy, but if you wanted to add anything to that, please do, but don't worry if you don't.
Yeah, it just says, yes, we will can still support her and it would help her.
Definitely. Thank you. So I'm not sure if that's the last one. 17-year-old male had unprotected sex with someone yesterday who he has heard is HIV positive. Where can you refer that young man?
So yeah, we've got A&E coming in from the chat and Leeds Sexual Health.
Definitely, yeah. I think I'd be tempted at the moment to go Leeds Sexual Health route rather than A&E. But yeah, I'd be staying out of the hospital at the moment. And definitely in terms of Leeds Sexual Health, they'd be brilliant at advising that young person, and they could also provide any other STI tests as well. Is there any other ones for that one?
No, it's just the same, yeah.
Yeah, because they could also refer maybe support around making sure you have safe sex and that young person has safe sex in the future. Oh, and that is it. Has anyone got any other questions? That's a bit of a whistle-stop tour of services in Leeds. And obviously I've not covered every single service that you could refer a young person to. So I've referred to like the public health or the what we sort of usually call school nurses in Leeds. And they have the chat health service. So young people can text and talk to a school nurse, and they would they're very good at talking to young people about sexual health as well and about referring. And we've got lots of other services that offer sexual health support, so places like the marketplace and lots of other third sector services that do that as well. But they're sort of the main services really that you might be referring young people on for treatment and contraception. But like I said, everything is on Leeds Sexual Health. It's as up to date as we possibly can make it right now. If you notice that your service is on there and it's not up to date, please let us know. But yeah, keep checking back for the most up to date updates, I guess. Can't think of the other word for that. Has anyone got any other questions or anything that they're not sure about? No, have we got anyone typing?
No. Oh, we've got one. Somebody is typing. Yes. Feel free to unmute yourself as well. James has put, do we cover chemsex?
Chemsex.
Chemsex.
So chemsex is it's not something we cover in this training, but generally it's generally men who have sex with men who use drugs whilst having sex, and it can put people at risk because they might be less likely to use contraception, or they might maybe engage in behaviour that they wouldn't normally engage in because they're under the influence of drugs. It's not something we generally cover in 3-in-1, but the Leeds Sexual Health Service are really good at supporting people around that, and also MESMAC. So we have MESMAC is a third sector organisation in Leeds that are really good at supporting men who have sex with men around their sexual health and around their mental health as well. And they work closely with Forward Leeds around drug use, so supporting men around their drug use in terms of chemsex and in an understanding kind of way, because we know that for some young men it's not about the drug side of it, it's about sort of their self-esteem and about whether they feel confident in having sex. So it's more to do with supporting young men about their mental health, really. But again, if you look on the website leedsexualhealth.com, you can get details of MESMAC and more information about how they can support people around that side of things. I hope that answers that question.
That appears to be all the questions.
Anything? Is that everything?
Nothing else.
So I hope that was useful for you all. Like we said at the beginning, this has been recorded, so if you ever want to return back to it, you can watch the recording once we let you know where it's going to be posted. I can also send you a PDF of the presentation, so you've got that information as well for reference. Like I said as well, we'll send you the link for the video and the facilitator notes that go with that video, so you can use that in sessions, or you can feel free to use it on your social media or put it on your websites. It's free for you to use in that way. And if there's no other questions, for those of you joining us for session 3, we'll see you tomorrow at about 10ish, and we're on Zoom again, so hopefully it'll be a little bit easier to manage. Is that any other questions that have just popped up, Catherine?
It's just saying a PDF would be great, thanks. So
Fab.
Yeah.
Lovely. Is there anything you want to add, Catherine?
No, not at all. No.
Right, well, have a great rest of your day, and I will speak to most of you tomorrow.